Welcome to my 34-week pregnancy update. At this point, my baby is the size of a cantaloupe, weighing 5 pounds and 6 weeks left to go. I'm still excited, but still a little bit nervous. I'm not sure what to think about having two running around the house, so we'll see how that goes. My baby shower went very well. I had a very good turnout, lots of friends and loved ones and family members, and look for a video on the baby shower gifts, my favorite ones, ones that I enjoyed the most, and there's actually some unique ones as well, so stay updated for that. I am having cravings still. The past couple weeks I've been craving honey buns, and it has to be the Little Debbie kind. I have not been wanting any other kind of honey buns, but I eat honey buns all day long, and I don't know why I want them, but I do. Also, apple juice. I've really been wanting apple juice, and it has to be very cold with ice. So those are my cravings at 34 weeks. Moving along to the health issue, I'm still gaining weight slowly. I've still only gained around 30 pounds, but the weight gain is still an issue for my transfers, getting in and out of the car and in and out of the shower, also getting in and out of my bed. My bed, the mattresses sit pretty high. It's a pillow top mattress, and we also have a pretty thick foam piece on top of that. Just because we have that, not because I'm a paraplegic, just because we prefer a softer bed. That's all. It doesn't have anything to do with my disability. But it is good if you are a paraplegic because it helps out with the pressure while you sleep. With all that said, because my bed is so high off the ground, I'm having quite a hard time getting in and out of the bed, and sometimes even have to count to 3 before I can get in. So that's one of the things that I'm having an issue with, as well as getting in and out of my shower chair. I'm not even going to attempt getting in and out of the bathtub right now. I quit getting out of the bathtub when I started getting a big belly. So those are the paraplegic issues that I can think of. That is the only thing, the only problem I'm complaining of from being a paraplegic and being pregnant is the weight gain and how it affects me transferring. My doctor said that it's normal, and it's just something because the weight comes so fast that causes you to have a hard time. Also, an update on my iron. I ended up going to have an iron infusion. Now, this was through an IV. My doctor recommended me to a specialist, and I went in the morning to have the infusion. They set me up with the IV, and you sit in a big, comfortable chair in a room with other patients. Some were doing chemotherapy, some were doing the iron IV treatment. About 30 minutes into my IV treatment, I had an allergic reaction, had to have Benadryl and steroids, and they stopped my infusion immediately. So my body does not want iron for some reason. The conclusion of the matter was that I am now taking a slow release or extended release natural iron tablet to try to build up my iron. The doctor is not concerned anymore about my blood levels as far as giving birth. She said I should be okay, and they're going to be prepared just in case. So we've got the iron issue pretty much taken care of or under control, and the placenta previa, good news about that as well. The placenta was in between the baby and the birth canal, or whatever you want to call it, and now it has moved up to the side The concern there was that if the placenta didn't move, I would have to have a C-section because it was blocking the baby from coming out. Now that it's moved, I can deliver naturally if everything goes well, which it is, and everything is better. I haven't had any more bleeding with the placenta previa or anything like that, and it's moved and everything's all good on that aspect. Now, this is one thing that I want to talk to you about that happened at 33 weeks. I woke up in the middle of the night in really bad pain. I was really sick, nausea, vomiting, and everything. I couldn't talk. I had to pretty much do sign language to my husband to let him know what was going on. He called the doctor. They both thought I had food poisoning. The only thing I had different from my husband and son was a yoo-hoo. My husband, he swore up and down that's what it was from. So the doctor on call, not my doctor, told him that I could come in, but it wasn't necessary. They would probably just treat me for food poisoning. So as bad as I was hurting, we went ahead and went to the hospital. Once I got there, they checked me out. I was hurting, still hurting so bad. I could barely get out of the car. I couldn't push myself in my wheelchair. It was awful. So when I got there, they did a few tests, and when she checked me, she found out that I was dilated to a 3. So I didn't have food poisoning. I was actually in labor, and that was at 33 weeks. So I ended up staying in the hospital for 3 days. They gave me lots of magnesium to help stop the labor, as well as a shot that they call TURB. That is a abbreviation. I can't remember the full name of the shot of the medicine they used. And also they gave me, when I first got to the hospital, a round of 4 pills. I'm not quite sure what they were called, but I had those the first day, and then after that I was given 2 steroid shots to help the baby's lungs in case they couldn't stop the labor anymore. I ended up dilating to a 4 and went back to a 3 before I left. I was released, went home, dilated to a 3. No contractions when I left. Everything was fine. Once I got home, I was very weak. I did have problems breathing over the next couple days. It could have been from the magnesium because it does cause problems with your breathing. I'm really not sure, but it went away. I feel better now. Still have a few contractions every now and then. So we're waiting to see what's going to happen with this baby. Now I'm 34 weeks. They're okay with me delivering him at 34 weeks, and he's had the steroids in him. So I will keep you updated. The next video will be the 36-week update video. Whether we have a baby or not, I will have a 36-week video update. If you're not subscribed, get subscribed because we're having a baby within the next couple weeks, and I am going to do my best to have that recorded for you. So if you're interested in how a paraplegic has a baby and any questions you have, you might want to subscribe now so you don't miss out on this exciting event that's coming up soon. If you have any other questions that I didn't answer, or want to know anything about my hospital visit, the early labor, or anything like that, please send me a message, a comment below, send an email, however you prefer. But I want to help someone, and I'm sharing my story. So if you know someone this can help, you share it with them, and I will greatly appreciate it. Thank you all so much for watching once again. I appreciate all the support from around the world that I'm getting, and I look forward to seeing you at 36 weeks.